Morning announced a state of emergency for the province of Ontario as part of the government's efforts to deal with the COVID-19 pandemic. As he then said, the situation is changing hour by hour. So we're pleased to have the Toronto Star's Queen's Park Bureau Chief Rob Benzie with us now via Skype from his home in downtown Toronto for the latest. Brother Benzie, good to have you with us. How are you doing tonight?
Happy St. Patrick's Day, Steve.
Well, sort of, I guess. Sort of, but not really. Let us go through a bit of a list here of what the Premier announced today, and then we'll come back and chat out of this. Sheldon, if you would, the graphics. Thank you very much. Here we go. The province is mandating the closure of bars and restaurants, although those that offer takeout or delivery can continue selling food. To be closed immediately, rec centers, concert venues, theaters, places of worship, libraries, private schools now as well, licensed daycares, all until the end of the month. What's open? Shopping malls still open, public transit still working, supermarkets, construction sites, and pharmacies. They have mandated that there shall be no gatherings of more than 50 people. And a reminder, there are 186 cases confirmed in Ontario of COVID-19, and we experienced likely the first death in the province today. Also announcing they are calling this the first stage relief package. $300 million set aside. That's $100 million from Queen's Park, $200 million from Parliament Hill. And what's it for? Well, how about this for starters? Adding 500 post-acute care beds, 75 critical care beds, and the creation of 25 additional COVID-19 dedicated assessment centers. That's a bit of a list. Rob, I guess I should start by asking you, is there anything that we didn't get on that list that you think our viewers ought to know about?
Well, later today, liquor stores will be on reduced hours. The LCBO outlets will be opening at 11 a.m. and closing at 6 p.m. instead of opening at 9 a.m. and being open till 11 p.m. So people will have to buy their booze in the middle of the day more.
Gotcha. Okay. The Premier, of course, declared a quote-unquote state of emergency. And while that sounds ominous, maybe you could actually fill in the blanks for us and tell us what it specifically means.
I mean, this is an order in council that the cabinet passed at 7:30 this morning. So this is not something they've had on the books for a long time. It's something they've been ready to use this emergency legislation that has been in Ontario for a very long time. And it was actually updated. I was speaking to Michael Bryant today, the former Attorney General, who's now with the Canadian Civil Liberties Association, and it was updated when Mr. Bryant was the Attorney General after the SARS outbreak. So this is a law that helps facilitate things. It helps the government do more things more quickly, such as order the closure of restaurants and bars and so on. And I think that it was not something that Premier Ford did lightly. It was something that we were inching towards. Certainly in the last few days, we thought we were headed this way. And the Premier got there this morning. The
Premier pointedly made mention of the fact that this is not a province-wide shutdown. There are businesses open, there's public transit open. We went through the list a second ago. Presumably they considered that and opted not to go there yet. How come?
Well, I mean, I think they want to flatten the curve. They don't want to flatten the economy. I mean, things are going to be rough enough for as many people as they are. I mean, for service economy folks, people working in restaurants and bars, this is going to hit them very hard. We're going to hear more tomorrow from the federal government about some of the measures that will be in place through EI and other programs to help those affected workers. But Mr. Ford wants to make sure, and I think that most people agree with him, that stores remain open that are needed. So you can get your groceries, you can get your wine and beer, and you can get your toilet paper because there's lots of it and people shouldn't hoard. But I think that the main thing that he was trying to get across is, if this isn't martial law, we're not in a situation like that where they're shutting the borders to the city so that you couldn't get into Toronto or anything like that. They're trying to do as much as they can to limit the growth of this virus. And I think that they're listening to the experts. Dr. David Williams, the Chief Medical Officer of Health for Ontario, is the one who gave this advice to the Premier and to the Cabinet, and they took it.
How has, based on the feedback you've received, how has this been received so far?
The opposition parties are saying this is the smart thing to do this methodically. Remember, the legislature will be back in session on Thursday to pass that law that Labour Minister Monty McNaughton discussed yesterday to protect workers so that no one's going to lose their job if they can't show up for work because of a COVID-19 outbreak, so that they can't, their boss can't say, oh, you're fired because you didn't show up, or you don't have a doctor's note. They're going to eliminate the provision for needing a doctor's note. and a bunch of other things that are going to be in place to ensure that no one loses their job. This is going to cause enough problems for the economy. I think that the premier and the finance minister and the labor minister and the health minister and others are trying to mitigate those problems as much as they can.
You know, Rob, well, you certainly know as well as anybody that there's an old maxim in politics that you figure out where the story is going to be in a week's time, and then you go there right now and save yourself the trouble. We have heard, for example, Dr. Michael Warner from Michael Garron Hospital in Toronto saying this isn't good enough. We need to shut everything down right now. How much pressure do you think there is out there to take that step right now?
Oh, there's certainly a lot of pressure. We've heard it from some health people, but the premier is listening to the chief medical officer for health. Dr. Williams is the most important public health official in the province, and the premier is taking his counsel, not taking the counsel of every armchair quarterback or pundit or whatever who's saying, shut it all down. This is what we need to do, and have a curfew and all these other kind of things. I'm not saying we aren't headed there. I don't know that we are. I don't know that we aren't. But I think that the premier and the cabinet are being methodical and listening to the experts. And Dr. Williams is their expert.
Now, you pointed out a moment ago that a lot of people are going to take a financial bath as a result of this. Never mind small business owners, but particularly the people, the wait staff, the people who are not taking tickets at the Scotiabank Arena. I mean, we can make an endless list of people whose incomes are going to be affected by this. What do governments have up their sleeves to deal with this income loss?
Well, we're going to hear more from Finance Minister Bill Morneau in Ottawa tomorrow. It's going to be huge, but I thought it was very significant today, Steve, that the premier said no expense will be spared. Those were his words to make sure that people get through this. And I think that's important because it's stressful enough and there's enough anxiety about the virus itself without everyone worrying about watching their TFSAs and their RSPs and so on vanish or get smaller thanks to this. I mean, it's going to be a roller coaster ride on the markets for a long time yet. They will come back. They always come back. So people should not stress too much about that. But I think the premier is concerned and rightfully so that people are going to get their paychecks and that people are going to be able to have some, forgiveness on their rent or their mortgage payments or some of their bills. Those are all the things that government is looking at. It's still in motion. We don't have anything finalized yet, but I think we're going to see in the next couple of days a much more firm plan from Ottawa and from Queen's Park to ensure that no one is thrown out of their house or anything because of COVID-19.
Well, let me follow up on the tenant issue because you just raised it there. The premier and the cabinet were pointedly asked at the press briefings that have taken place over the last couple of days, what about something in legislation that would prevent anybody from being evicted because they can't pay their rent right now or they can't pay their mortgage right now? And the government has, as of yet, not brought forward legislation on that. Is that a problem?
It could be a problem, but I want to wait to see the legislation that's tabled on Thursday. I think that it's going to be a bit of a hodgepodge. The NDP is concerned, for example, about those kind of things, people getting evicted. They're also concerned about paycheck protection because right now the government's just said your job is going to be safe. They haven't really said anything about guaranteeing a paycheck if you're a bartender or a waiter or a server or you work at the Air Canada Centre or Scotiabank Place, and you can't get paid. We've seen some employers are behaving better than others. I think the Calgary Flames are treating their workers very, very poorly at the Saddle Dome and not paying them when they're out. But then you see in other jurisdictions, people are paying them. I was walking by the Bellwoods Brewery here in downtown Toronto and on Ossington today, and I noticed that they said that they are going to continue to pay their workers even though their brew pub is not open, their brewery is open. So I think there's a lot of wiggle room for employers, and that the premier and the cabinet are going to make sure that there's flexibility to protect workers.
And in fact, we've seen professional athletes put together, huge sums of money, six-figure sums in order to protect those who are losing paychecks right now. So that's impressive.
Yeah.
Let me ask you about this, Rob. This virus has killed people in this country prior to today, but none in Ontario. And it's thought that today Ontario got its first case. What can you tell us about that?
Well, this is a 77-year-old Muskoka area man who died in a hospital in Barrie, and it looks like he had some pre-existing conditions, so there is that, but he came in contact with someone who has tested positive for the virus So they're going to be doing an autopsy. They're going to try to find out for sure if this is what killed him. Because, as you say, Steve, we hadn't had a death in Ontario. We've had several now in BC, but this was our first one here that's potentially linked to it, and that's a scary fact. I thought Dr. Williams handled it very well this afternoon, explaining as much as they know and saying, look, we don't know for sure, but this is what we think. And I think this is the thing. Information is key in a crisis like this, and you have to be as straightforward with folks as you can be without causing panic.
Sure. Rob, what can you tell us about the healthcare system right now in terms of whether or not it is adequately resourced to take on the added burden of treating patients who are undoubtedly going to be coming forward with this virus in the days and weeks ahead?
Well, clearly the Premier is concerned and the Health Minister is concerned, and that's why this morning he made the announcement that he did about more acute care beds and so on. And they've already had more added. Yesterday they added 130 nurses to telehealth because they really want people to be phoning and instead of showing up at healthcare facilities. I speaking to the finance minister about this the other day, and the biggest concern the government has is ensuring that healthcare workers are safe and protected from this virus as best they can be, because we are concerned. Obviously, we should be concerned that we could be swamped. We aren't yet, but remember, so-called hallway healthcare or hallway medicine, depending on which opposition party or which governing party raises the topic about people being treated in hallways of hospitals. That's already an issue in Ontario. Hospital wait times are a concern already, let alone with a pandemic like this.
It's really good that you put on the record the fact that the healthcare workers are really a top priority and their protection, because it was, of course, 17 years ago during SARS when we had, I think, 44 deaths in the province of Ontario over that, and many of them were frontline healthcare workers who lost their lives trying to save other people. So they've got that covered this time, I gather, yes?
Yes, and you know what? You raise a very good point, Steve. SARS in 2003 prepared Ontario better than many, many other jurisdictions for what we're going through right now. If we hadn't had that, it's hard to say, the protocols that came in place in the wake of SARS at hospitals, for healthcare workers, for governments, et cetera, in legislation, it's hard to say how bad this could have been. It could have been even worse if we hadn't had the SARS experience, which was so deadly in Ontario and far more deadly, frankly, than coronavirus has been.
Indeed. Rob, I'd like you to put your political analysis hat on for a second here and tell us, everybody who's in a decision-making position of authority today around the world is being judged by the electorate, by their citizens. And Doug Ford will be no exception to this. How do you think he's doing so far?
I think he's listening to the experts. He is sticking to what we know and to the facts, and he is being very serious about it. There's no bombast. There's no freelancing. And I think that Mr. Ford is getting good reviews from folks this week because he is doing what a premier should be doing. It doesn't matter what political stripe you're in. You should be listening to the healthcare experts, listening to first responders, listening to the hospitals, listening to these folks, finding out what they need and moving forward, and then move forward. As we've seen in the United States, for example, the current president, Donald Trump, seems to be all over the map on these things. And I actually don't think this is going to help his reelection chances in November, because he sounds, initially he was calling this pandemic a hoax, and now he's denying, and now he's saying that he always thought it was serious. So he's getting caught in his own lies. My former colleague Daniel Dale has made a career out of chronicling Mr. Trump's lies, and they've just compounded through this pandemic. But here in Canada, we've been fortunate that our leaders, we have our mayor is in self-isolation because he was in England, John Tory. The Prime Minister, Justin Trudeau, is in self-isolation because his wife has COVID-19, and the federal cabinet yet is still able to meet, and things are going, relatively well on that front, I think. And Premier Ford and the Prime Minister are working closely together. They're singing from the exact same songbook. We don't have the kind of sniping that we've seen in the United States, where you had the President of the United States sniping at the governors of Michigan and Washington and New York today, which is extraordinary in a crisis. This is not the time to be doing that. This is the time for working together. It's not the time for partisanship.
I gather before Doug Ford announced the state of emergency today, he called the Deputy Prime Minister of the country, Chrystia Freeland, to give her the heads up that it would be coming. So I suspect that's an indication of the decent cooperation that's happening right now.
Yeah, he thinks very highly of her. He said that this morning. The Prime Minister, in his remarks, praised the Ontario government, praised Mr. Ford. And remember, it's not that long ago that they were campaigning against one another, or at least Mr. Trudeau was campaigning against Mr. Ford. But that was yesterday. This is today. And I think that Canadians, Ontarians expect their leaders to do their jobs. And I think that both the Premier and the Prime Minister and the Mayor are doing what they need to be doing at this time.
My On Poly podcast pal, John Michael McGrath, had this to say in his column today on TVO.org. He said, if you get this right, let me rephrase. He said about the Ford government's actions, if you get this wrong, nothing else will matter. If you get this right, the public will forgive just about anything. You want to sign on to that?
Well, I mean, it's, a week is a lifetime in politics, as Harold Macmillan said. And I think that we are many, many years and months away from an election in Ontario. I think that politics really isn't paramount right now in Premier Ford's mind. I think he's more concerned with ensuring that the province weathers this. And he's reiterated a message of unity. I noticed yesterday, for example, Stephen Del Duca, the new Liberal leader, was at Mr. Ford's announcement, and Mr. Ford said he'd spoken to Mr. Del Duca, and we saw the Premier meeting with the other leaders last week, Mike Schreiner of the Greens and Andrew Horwath of the New Democrats, to discuss next steps. And I think that's really important. And I hope Thursday, when the legislature is back for this quickie session, because remember it's March break, so they would have been off anyway. This quickie session, I hope there's not a lot of grandstanding and that kind of foolishness. I suspect there's a little appetite for that, and I think that all the parties are going to be behaving at their best.
Mm-hmm. Do you know if there are still additional powers on the books that the Premier and his cabinet could bring to bear should they choose to?
Yes, I mean there are. We haven't had a curfew or anything like that. When I was speaking to Michael Bryant earlier today, we were talking about, because he poured over the orders in council with me that the government released this morning, that they signed in cabinet at 7:30 a.m. And they're pretty limited in scope right now. But there are measures that the government could take. They could, in theory, have a curfew. They could, in theory, order more closures. Remember, they've asked restaurants and bars to close, but if your restaurant is open and you have people sitting in it, that's frowned upon. But they haven't. There's no punitive measure in place that they've announced that would be part of punishment. They're really relying on the best of people, and I think that's an important thing that the Premier said this morning, is that we are going to trust our citizenry. We're going to ensure that we all work together, and we will get through this. And I think you have to think of it like the Blitz in Britain in 1940 or something. This is an existential threat, and everyone is kind of rallying together to fight it.
You use the word punitive in that sentence, so I'm going to ask you about the corrections system in the province of Ontario right now.
Yeah.
To that end, I am hearing from lawyers that they are deeply concerned about a couple of things. Number one, there's no more visitation rights for prisoners. Yes, they can see their lawyers, but the notion also, number two, of social distancing behind bars, it's just not on. Is the government on to this issue?
Yeah, Sylvia Jones, the Solicitor General, is looking at it. There are some problems and there are some concerns, frankly. I mean, they've said if you're serving a weekend sentence, for example, and you're supposed to go every weekend, you work at your job during the day or during the week, and then on the weekend you serve your time. They've limited that. You're not going to have to do that because of the COVID-19 outbreak. But what about the people who are waiting for bail hearings, for example? Some of those people are in a lurch. Yes, you're still going to be able to have a visit from your lawyer, but you're not going to be able to have a visit from your family. So there are some folks that are collateral damage, I guess you could say, in this. The government is looking at it, but they haven't rectified the situation yet. And people in provincial jails would be considered pretty high risk for, I would think, because of the proximity. If one person in a jail has COVID-19, that would be very hard for others not to get it, or for them not to be exposed to that person.
Rob, we've got about 40 seconds left here, and it's enough time for me to ask you about what is now not going to be a budget that will be brought down in 8 days. It was supposed to be a week tomorrow. It's not happening now. It's going to be an economic update. Probably fair to say that whatever economic prognostications the budget was going to bring down in 8 days' time, those are all blown to smithereens right now?
Yeah, I mean, Finance Minister Rod Phillips said that he has repurposed this budget, his first budget as treasurer, and it will be a fiscal update just basically about COVID-19 and where we're going with revised projections. Because remember, they had pretty much locked down the budget that was to be delivered next week, and we're looking at projections for growth that would be considerably off now, given what's happened. So he'll come back in the fall with a proper budget. But I think this is going to be a very focused, narrow document. And Steve, you and I have been in lots of budget lockups together. There won't be a budget lockup, for example, and there couldn't be because you can't have a gathering of more than 50 people inside together. So it'll be a document that they will presumably just hand out and distribute. It's not clear to me how that will work because the House is supposed to come back on Monday. But it's not clear that it will come back on Monday. That's still to be determined because the government, the legislature, has given itself the power because of this outbreak to not have the House sitting. So it's unclear to me how that's going to work if Mr. Phillips tables his fall economic spring budget / economic statement without the House sitting. But these are little things that hurdles that can be cleared. There are bigger concerns, and what's in that document will be far more important than how it's delivered.
Gotcha. Rob, thanks for joining us tonight on TVO. Really appreciate it.
Thanks, Steve.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.